Hi again, everyone. We are back with Crushing Doubts Q&A, Mondays at 6 p.m. Eastern, 3 p.m. Pacific, every week. I'm very excited to be here again to answer any of your questions. And if you haven't already, click subscribe, ring the bell for notifications. If you like what you're hearing, it's a little early in the show to ask for that, but if you like what you're hearing, click like and put your comments below. I have definitely been getting back to people and will keep doing so directly. So any questions you have, go ahead and put it in the comments, and I'll get right back to you. Starting off the show, this has started to happen more and more. People have some comments that they want me to bring to the show when they can't be here live. So we have a question coming in. This is from Lorian. And if we can pull that up on the screen, let's see what her question is. Here it is, Lorian. I read that symptoms will shift repeatedly as long as the underlying psychological conflict remains. I have resolved my original symptom, but now I've been stuck in a revolving door of changing symptoms for several months. I've been journaling a lot and have addressed every issue I can think of, but have apparently not identified and resolved the underlying psychological conflict. Any suggestions? Okay, now listen, there's a lot of directions we can go with this, Lorian, but one of the things I would say first is that this is one of the reasons that I, in studying my own experience, had to understand that doubt was playing a big, big role. Because everything I had read was about emotions. It was about how unconscious emotion was leading to a threat to the self, essentially, and the symptoms were there to distract from that emotional conflict. Now, I'm not saying that's not what is going on, but what my experience is that the emotional situation leads to the initial onset of a symptom, and it leads to upticks in symptoms. So if you have resolved your original emotional situation, and thus that original symptom goes away, what does it mean that it moves to another symptom? Now, there are several possibilities, and I'm going to want you to follow up with me on this to make sure that I answer your question well. But there are times where these new symptoms are about a new emotional experience. So that is one possibility. But a second possibility is that you've started to enter into a phase of your mind-body experience or issues, because we all have a mind-body experience that's just our lives, where you have begun to get into a thought pattern with yourself that it's one thing after the next. And as a result, the mind-body process, or as Sarno called it, TMS, gets a hold of you in a way that starts to have you doubting that you could ever get better. Or you could start thinking, well, I don't know, there's just something wrong all the time. But here's the thing. We have to remember that a mind-body process is at base a psychological defense of sorts. And so Sarno, his postulation was that it was a distraction against these painful emotions. Again, I'm not saying that's not the case, but there's lots of ways we can think about this psychological defense. In addition, though, I have posed that it's not just a defense, it's also a communication. And that is where I think we can come to rest in a good place to understand it, because it's really both. Your mind is dealing with a conflict, and that conflict is, do I want this information conscious or not? And the Sarno side of things, for lack of a better way of putting it, the Sarno side of things is saying, no, we want to keep it unconscious. But the reason that defense has to be there is that there's a part of your feelings that is driving towards the surface, that wants this to be conscious. And that's the communication piece. So if you're getting repeated symptoms, one of the ways that we can understand it is that you still have a lot of things you're communicating with yourself about. And if we can understand what those things are, you won't have the reason for the ongoing symptoms. So that's one side of things. The other side of things, though, is that even if you've gotten the right emotional understanding, a doubt process can continue your symptoms for the rest of time, basically, where you go from one thing to the next. And I really encourage you to think about doubt as another aspect of what might be going on. If you're having doubts, it activates your whole fear response, your sympathetic nervous system, your fight or flight response. It's called many different things, but essentially your whole body is revved up in a state of fear, concerns, And listen, it can just be confusion or questions. That alone makes us less at rest. So I would say, Lorianne, those are the two sides of the equation. It's possible that there is an emotional aspect that is either popping up in many different themes or is getting revisited in new themes because you're on to the one symptom and it just shows up in another. That's called the symptom imperative, where a symptom substitutes for another. That was another thing coined by Sarno. The other aspect is that it could be doubt. Now, there was a second part to Lorianne's question, I believe, so I want to bring that up now. Also, I understand that I've got the TMS on the run, but how am I supposed to tell if each new symptom that pops up is physiological or just another mind-body symptom? I have doubts about the new symptoms sometimes. Love this question for multiple reasons. One is that in the mind-body community, and again, TMS stands for tension myositis syndrome. That's what Sarno called it when the muscles got sore from oxygen deprivation. That's the way he understood it. But it became extended to all mind-body issues, that term TMS. It's now called mind-body syndrome or PPD, psychophysiological disorder. I don't tend to like to label it a syndrome or a disorder, though, because I actually think this is just the human condition. We all express things in our bodies that come from our minds. The idea of it being on the run, though, this is an important concept because in mind-body work, one of the things that I certainly came to see, and I learned it through Sarno, is that when you're on to a symptom and you kind of use your self-talk and your thinking to say, no, I'm not going to buy that this is a purely physical thing. Remember, it is physical, but it's not purely physical. It comes from your state of mind, and that's changing your physiology. So once you're on to that, a lot of times the symptom will give up. It'll say, okay, you're on to me. I understand. And it'll move on to another symptom to try to fool you into thinking once again, nope, this is purely physical. If it succeeds in doing that, then it will stay in that symptom for as long as it needs to. So that's one way of thinking about what it means to have symptoms on the run. But usually when we mean it's on the run, you've gone through multiple symptoms. You've gone through one symptom, then you get to another, and so on and so forth. And it's generally regarded as a good sign of recovery. I'm going to get into, though, when it can mean something different. It's never a bad sign, but sometimes it's not the good sign people think of. I'm going to get to that in a second. The first thing I want to say, though, is, again, for those of you who just joined, if you haven't already, click subscribe, ring the bell for notifications, hit like if you like what you're hearing. And remember to ask your questions. The more questions that come in, the more people learn. You know, I learn from everybody's questions. And a lot of what I share with people is that I learn through the questions, but I also help people articulate their questions. I do see Lorianne has a third question. Love these questions, Lorianne. Keep it up. Let me actually finish. So let's take that down for a second. Bring up the second one again, because there was part that I didn't get to about it being on the run. We'll get that up in a second here, if we can find it. Well, while you're doing that, I'm going to keep talking about that a bit. People often ask me, well, why, if it's a good thing that I've got it on the run, why am I not getting all the way better? Why does it just keep running from one thing to the next? That is a sign that there's doubt. And at the end of Lorianne's question, actually, we don't need to bring it up because I remembered now. At the end of her question, she said, I begin to have doubts about the new symptom. Well, that's by design. Your mind-body process is going to try to fool you again and again. It's always working for a safe spot to rest. And I'll tell you why. This is a psychological defense. Well, psychological defenses require a home base. They're looking for a place to sink their teeth into. It makes it sound like they're very aggressive, which in some ways it can really feel like they are. They're looking for a place to be able to settle in. And if they have a symptom that really is fooling you, it's going to settle in better. This is why people sometimes say to me, well, but how can it be a mind-body symptom? It is so convincing that it's purely physical. And I say, yes, of course. It's trying to be as convincing as it can possibly be. And so the more convincing it is, the more likely it is to make you doubt. And so, yes, I know you're doubting, Lorraine, with the new symptoms. The job here is to recognize that the chances of you having a mind-body experience on the one hand, and then suddenly a purely physical symptom is very low. Now, I will say, if you're not sure, you go see a doctor and you get it checked out. That is not going to hurt you, other than that they may have some structural diagnoses that are not going to turn out to be true. But when it comes to doctors, it's very important. We go to them when we have any doubt, because at worst, they will rule out something purely physical or get to something purely physical. And then they will also help us to grapple with any questions about a structural issue. So if they diagnose you with a herniated disc and they say that causes pain, that's when you can come to a mind-body practitioner like me, and I can say, actually, the studies, all the science shows that is not the case. Now, we'll get to Lorian's third question, but we have some other questions rolling in, so I'm going to get to that now. P to the @ is returning. Patrick, I believe, is your name, if I recall correctly. What should you do if you've been able to eliminate pain except during certain exercises? I used to be a cyclist, but haven't been able to get back to the sport. Fantastic question. Same thing happened to me with basketball, Patrick. I was pretty much able to do everything, but I was still worried about basketball. And not only that, when I would play, I actually would get pain. So how does this make sense? This is one of the reasons I love this question, because we have to understand the logic that would explain that. It sounds crazy because I'm able to jump around unless I'm playing in an actual basketball game. That doesn't make a whole lot of sense. So what it suggests when it doesn't make sense like that is it must be coming from the mind, because the mind is the one that can have those kind of irrational experiences. So, Patrick, the thing that you need to do, and this will happen, you'll have to decide when you're ready to do it, because what I would say is that cycling has become a trigger for you. It's something where you come to expect pain, and you need to challenge the trigger, and you need to do it in a very specific way. You go in and you say, okay, I'm going to do it. And I know it might hurt, but one thing that you can remember, one of my catchphrases is, it might hurt, but it can't harm. You cannot harm yourself this way. A mind-body issue does not cause damage. So you're not going to hurt yourself. What you're doing, it's kind of like exposure therapy in a way, but you can be more consciously aware of the fact that you are likely to be triggered at first. But if you push through that and you interpret it as a trigger, and you remember the mind-body process, and you remind yourself during the exercise, I am able to do this. I'm not actually injured. This is just a mind-body process. That's one thing. You also want to think emotionally. So while you're cycling, you should be thinking, where am I in my emotional life? Did something happen with my kids? Did something happen with my wife or husband, as the case may be? Or did something happen at work that was upsetting? So the more you start to think in a mind-body way while you're doing the exercise, you can disable that trigger. Patrick, let me know if I answered that question to your satisfaction. We can get back to it. Matt Anderson has returned as well. Thank you guys for coming back. It shows that there's value to this, and I really appreciate it. So Matt asked this question: how close are we to using fMRIs, that's functional MRIs, I'll explain what that is in a minute, and cortisol tests, saliva, sweat, earwax, to show real progress is being made with mind-body work, besides just symptom improvement, and to also use for preventative? I think there might be more to that sentence. We'll get to that. Okay, I'll figure out what that part meant. Matt, let me answer the first part for you. So fMRIs are what are called functional MRIs. What that is when an MRI is taken, it's usually a static image where you see what's happening inside in the soft tissue. That's an MRI. An X-ray is not the soft tissue, that's the bones. An MRI is the soft tissue. A functional MRI is about how that tissue is functioning. And so you see changes in blood flow and things like that. So what Matt is getting at, I think, and you can let me know, Matt, if I have this right, but what he's getting at is how close are we to showing very physical evidence that a mind-body treatment works? So this is a great question, Matt. And I want to first admit, I'm not the leader in our community about this. I would say that Howard Schubiner is the one who's really leading the way here. His research is phenomenal. So I don't actually know how close we are, but here's what I do know. There's a lot of investment in the community. I believe Howard Schubiner is working with Dave Clark, who is another leader in the field, and a couple of other people to really develop the research and show this. But the research is happening outside of the mind-body community also. So I think you can get a sense of it. I just was talking with somebody that I'm working with, and she got a blood test, and it showed raised cytokines. Cytokines are the things that show up in the bloodstream when you are having an inflammatory process. So we can see the physicality of it. The interesting thing is they told her that they could use this as a way to diagnose having fibromyalgia, essentially. Now, the reason this makes me smile is that they're diagnosing a disorder based on the symptom. So they have it backwards. The presence of the symptom doesn't mean you have the disorder. The presence of the symptom means an inflammatory process is happening. It does not reveal the details of it. So Matt's question is a great one for multiple reasons, including if we can show that, we can show the evidence, then we can show that this treatment really works, not just in reducing symptoms. I would suspect, Matt, that we are not only close to that, I would say it's probably already out there. I need to find out more about it. But I will say this, Joe Dispenza, in his book, You Are the Placebo, he has studies where they did meditations, and they actually brought down people's symptoms of Parkinson's. This is a very serious autoimmune struggle that people have, and it can be devastating for people. And he did, I believe, functional MRIs, actually, so just right in line with what you're saying. And they showed, and we see this in many, many research studies of all different kinds. So, but he showed that the centers of the brain that were causing those problems were in much better shape after the meditation. And then we're also seeing it with symptom reduction. So I think, Matt, we're already there. We're already getting it, but we need more of it. And I applaud you for thinking that way, because the more we prove it with science as well as logic, the better. The second part of Matt's question was to use this for preventative reasons, to recognize that someone is on the path of having chronic stress and emotional issues. Oh, great point, Matt. So what Matt is saying is that we can not only use this to prove that a mind-body treatment can work, but we can also, once we do that, start to utilize it in ways where we can have our emotional lives more front and center so that we can prevent deeper chronic stress issues. Let me address that a little bit, since it brings us into a whole different territory. And I will admit, this is controversial stuff, but again, the science and the logic, I feel really fits with my work and mind-body work. So my thinking about this over time, having done a lot of research on this and having a lot of experience with it, is that autoimmune issues can be triggered by a mind-body process. It tends to have to be pretty extreme in terms of a lack of emotional awareness and a great deal of emotional trauma that's all buried and can kind of move us towards these things. I have no fear, though. You usually get multiple symptoms that are not autoimmune issues before you hit that autoimmune wall. But there are people that I can say pretty certainly that it was a major risk factor or a contributing factor. How much was it a factor? I can't say that. You know, as we look at cancer, for example, I want to be very clear about this. If if emotional issues, buried emotional issues, traumatic emotional issues can cause or contribute to an autoimmune issue, that doesn't mean that the person who gets it did it to themselves. That is not what we're saying here. No way. These are traumas that came from the outside. These are traumas that came from the environment. It's just like if you were around asbestos too much. If you're around a toxic human being, it actually does the same thing, because what it does is it floods your whole system with the sympathetic nervous system response. And that is not supposed to be happening all the time. That's a fight or flight system that's supposed to be there for emergencies or when something's in danger. If you have it all the time, it can lead to major changes in the body. So Matt's question brings us to the fact that if we can recognize this, then we could discover that good therapy is not actually a luxury item. It saves lives. So I have a lot more to say about that, but let's follow up with people as more questions roll in. I do think we had that. Yep. Last comment from Lorianne, unless she has more coming. Well, let's see. The only problem I've found with mind-body work is that I've gone from thinking that I'm physically messed up to thinking that I'm psychologically messed up. Oh boy, I've been there, and so have so many other people, with scars from traumas and hidden issues lurking in my unconscious. Either way, I'm messed up. How can I get past thinking that there's something wrong with me? Fantastic question. And I want to leave that question up because there's a lot in here that I need to touch on. So first of all, I wanted to express a lot of empathy to the sufferers out there. It's very hard to have these issues, whether physical or psychological or psychologically induced physical problems, as we're talking about now, without wondering, well, why me? I remember when I was suffering from terrible back pain that I would look around at all of my peers and none of them had this. None of them. I was 28 years old. And so I did naturally think, what is wrong with me? And like Lorianne, I thought, well, I guess something's physically wrong with me. I don't know why. And that didn't make a whole lot of sense to me. It also seemed really weird, a weird coincidence that my father had had cancer very young and then I was having this physical issue so young. And it got me to wonder, like, okay, was this just some weird genetic something with my body being physically wrong? Then I remember talking to a friend who had been listening to Howard Stern. Now, a lot of people hear about Dr. Sarno through Howard Stern. And Howard Stern is one of the most known people who has used Sarno to get better. There are stories of him doing his show lying flat on his back with the microphone dangling in his face because he couldn't basically sit upright. He was in so much pain. And he discovered Sarno, and he's been a great ambassador for Sarno. So thank you, Howard. But this friend of mine didn't really get it. He listened to Howard Stern. He understood that it came from the mind, but he said to me, oh, well, it's all in your head. That's the interpretation that people often have of this. Patrick, I do see your questions. I'm going to get to you in a second. Let me just finish up with this. But a lot of people hear this and they think, okay, well, if it's in the mind, then it's made up and it's not real and it's your fault. All of these very negative things come crashing in. And that happened for me, even being a psychologist who understood the terms psychosomatic as not a toxic term. When it was applied to me, I didn't like that. What it gave me was a sense, just like Lorianne had, that, oh, great, so I'm choosing between being physically messed up or psychologically messed up. So there's a lot of ways I can answer this, Lorianne, but I would say here is the way that I've come to see it. In my work, I've developed these 3 different columns. The emotions column is basically a way to recognize what themes you have going on that are hard for you. And you get to decide for yourself, is it fair to judge yourself for that? It's not always easy to stop, even if you know that it's not true. Doubt is perfectly natural as well. That's the second column. We have so many questions. Nobody's talking about it in a clear way. Hopefully I am, but that's what I'm working on. And please let me know in the comments if you have more questions and things to clear up from what I'm saying or otherwise. And the third column is the power column. And this is the one I wanted to address when you ask, how can I get past thinking that there's something wrong with me? So the power column is really about taking your story, your mind-body story, and ending the self-attack about it. Here's the way that I map it out for people. The people who have had trauma, it was not their fault. It was not them being oversensitive. Anybody who had these experiences would have trauma from them. They might respond to that trauma in a different way. But there's an interesting combination of the type of people who have trauma and then end up with mind-body issues. And the good news is it's highly complementary. What I mean by that is that you have to have a lot of good traits to end up with mind-body issues. Believe it or not, having mind-body issues is a sign of being a good person. I hate to say it that way because it sounds like we're being punished for being good. But Sarno had a term. It was called a goodist. It was about the people who tended to try to do good for other people. And those people bring a lot of stress onto themselves. So in my experience, people who are not very concerned with other people, maybe not the nicest people, tend to not even get that much stress. And it's not fair. But one thing you can give yourself a pat on the back for is you got here because you had things happen in your experience that you didn't ask for, that were very hard, that you worked through. And on top of it, you chose a psychological defense that didn't hurt anyone else. It's like the people who fall on the grenade. Now, the job is to stop falling on the grenade, but not to criticize yourself for the fact that you unconsciously chose that path because it was the best choice. It was the best choice you could make to keep yourself safe, to keep yourself out of conflict with some of the people who were causing some of these things. I say this all the time. You are not the cause of your mind-body issue, but you can be the solution. I'll get back to more of that, Lorianne, as a follow-up, or anybody else who has a follow-up on that. Patrick has another question. Let's pull that one up. He says, one concern I've had about pushing through the pain, so we're returning to cycling, I believe, is I'm worried it could lead to pain pathways becoming more embedded. Not sure how much to push through. Thanks. Fantastic question, Patrick, and I understand the plight that you are in. Here's what I would say. You need to, you're saying not sure how much to push through, and I wish I could give you a defined and clear position on that. But it's always going to depend on the specific person involved. So we have to ask where you're at. You might not be totally ready to do it, let's say, to go for a long bike ride, but maybe you're ready to go for a minute. One thing I want to encourage you about is you want to fight the fear in this way. You have to remind yourself, this is where the FDR quote comes in, the only thing we have to fear is fear itself. It really is true. If you can master the fear, you will be fine. So you don't have anything to fear but fear itself. So what I hear in the question, and I don't blame you for it at all, is a lot of fear. The idea, you even said, I'm worried it could lead to pain pathways becoming more embedded. The only way that happens is if you're afraid. But I also hear another thing in that question, and this is part of what I do and how I can be useful, is I recognize certain little questions or statements that you're saying to yourself in what you're saying. So with you saying, I'm worried it could lead to pain pathways becoming more embedded, what is happening in your mind, if I'm right about this, and please follow up with me if I'm not, is that you are thinking about the idea of neural pathways. Neural pathways are, this is something Howard Schubiner talks about all the time, but many other people, Alan Gordon as well, a lot of people in the mind-body field talk about neural pathways, which are essentially repeated pathways in the brain that when you keep having the experience are just lit up over and over and over. Now, here is an area where I differ with pretty much everybody I've talked to about this. The experience, the science of it and the logic of it actually doesn't add up to the fact that the neural pathways being repeatedly used actually makes them stronger. In my experience, when people get the understanding they need, those neural pathways stop being used instantly. And so, Patrick, that's one way I want to help you think about this. Your pain pathways aren't going to become embedded. That word embedded is saying, I'm in danger of this becoming habitual. And I'm not saying that that's not the case, But I am saying it's not the case in a physiological way. It would only be through belief systems. So the good news is it's all about your belief system. So how much you push through on that is really going to depend on how ready you are for it. But I will say this. You have to trust yourself that you can try to push through it and still, even if you get knocked backwards into some kind of painful situation for a day or two from it, you still make gains, because it could be that you try it out and you're like, it didn't hurt that much. And we start to make steps towards being able to believe that we can do it. Once you believe you can do it and the fear is gone, you will be able to do it. Follow up with me if you need more. Now we've got a question from Matt Anderson. Do you see creating a visualization board to be helpful for others in exploring the power column during the healing journey? Wow, great question. I love to hear what people think about my work, because I'm the only one who talks about the power column. So Matt, who has worked with me before and said that I could mention that, brought this idea up. So I need to think about this, Matt, for a second. But I did also want to say, if you do come on and you have seen me before, definitely make sure you've given me permission to recognize that. I won't do that otherwise. I'll basically act like you are an unknown to me, because these are confidential meetings. But Matt has been nice enough to share that he has come to see me and gotten help from me. So a visualization board. Matt, can you actually say more about what you mean by a visualization board? I understand the basic terms, but I think this is a very interesting thing about psychology in general and just the English language in general. People can mean different things when they use certain words. So I'm going to need to know what you mean by that. I will take a stab at it, though, but this will be based on my own interpretation of it. So I want you to correct me if I have the wrong idea. I want to remind everybody before I do answer, though, that the power column is about your relationship with yourself. This can be in relation to how you think about yourself. It can be in relation to how you feel powerful or not in relation to others. And it can be in relation to whether you feel powerful in relation to your own symptoms. But they're all about interactions with the self. They're about interactions with the self when you're alone, when you're with people, and when you're with your symptoms. And a lot of you are with your symptoms a lot of the time. So we work towards feeling powerful. So a visualization board, I'm thinking that, Matt, what you're talking about is basically visualizing yourself into powerful situations. Now, I'm a football fan, so for those of you who are not football fans, forgive the reference, but there's a quarterback, Aaron Rodgers, who says that he visualizes before each game. And what essentially it does is it's a little like time travel. You go into the future because your body's kind of already been there if you got to visualize it. And I do think that that is useful. So if that's what you're talking about, Matt, yes, I do think that that is useful in the healing journey, with one exception. Okay, Matt's explaining now. Essentially taking pictures of items you wish to acquire or goals you want to accomplish. Yes. Okay, so I think I had the right idea, Matt, but let me know if not. Essentially, when you can picture the future, when you can picture that future goal that you want, you can kind of go there physically. However, there's one major exception, and this is really important. If you don't actually believe it at all, then you're actually just going through the motions. So when I talk to people about doubt, one of the things that I say to them is, or I kind of help them see, is a lot of times people are working against doubt, but really they're just saying the words. They don't believe it. And I don't blame people for that at all. You know, it's hard to come to terms with this and get to a place where you don't have doubt. And it's the job of people like me to help you get there if you're not getting there on your own. But if you're just saying the words, then you don't believe it. And here's the other side of the coin. Some people say that this doesn't work unless you believe it. So then people think, well, now I have to take it on faith. That's also not the case. Sarno said, one of my favorite quotes by him, you don't need a leap of faith. You need a leap of understanding. That is how we're going to get you to believe and actually believe it. It's from logic and science. So I would say in the power column, Matt, one of the main ways to think about it is logic. Now, this gets back to that question that Lorianne asked. I think I'm remembering that correctly. The idea that you have to believe in yourself to be able to get to a place where you can get better. If you don't believe in yourself, you're filled with doubt. Actually, can we bring up that third question again? I want to see if that's where I got it from. I want to make sure that I'm answering the right thing. This was the third question from Lorianne. We'll get it up here in a second. Meanwhile, Matt Anderson is saying the Packers should have won the Super Bowl. I don't blame you for thinking that. I think the Chiefs were exposed as a team with some cracks in it. But this is not a football show, so. But I honor that, especially for a Midwesterner. Can we get that third question from Lorianne up again? I think they are looking for it right now. In any case, I'll keep going with this, and if we can get it up, then I'll get at what I was wondering about. But the key is you have to believe it, and if you're going to believe it, it has to be convincing with science and logic. And I think the power column is really about the logic of realizing that you are powerful. We have another question here. I see. This must be from Lorianne also, but this is actually a different question. Well, I'm going to go ahead and answer this one, and then we can get, so maybe it was the second question. Sorry about that. So let's leave this one up. I'll get back to that shortly. Let's see. What has been your experience with sufferers of CFS? Does mind-body work offer real healing, or is it just symptom management? I hear and read things sometimes in the mind-body world that imply that I will have this condition for the rest of my life. Do you see full recovery in your experience, or is it something I will be battling for the rest of my life? I sometimes doubt that I will ever, I don't know, get better, probably, something like that. Okay, now this is really interesting. A lot of times, there's all these acronyms that get thrown around. This is funny, but there's so many acronyms that I'm like, I don't actually know what CFS necessarily is referring to. I believe she's talking about chronic fatigue syndrome. And this is one of those big ones that I will say, and my heart goes out to all of you with the suffering, but there's certain diagnoses that I think can feel like a death sentence to people. They just feel like, well, I'm going to be stuck with this forever. There's a colleague of mine in the field who I've trained some. He originally came to see me, but I won't mention his name because he hasn't given me permission yet. But he had chronic fatigue syndrome, and he's written about it. And it is it's one that's sometimes harder to manage, and I'll tell you why. The doubt that's in there. Certain symptoms lead to more doubt. People say, well, how could I possibly be this tired from it? They can't understand what would be the physiology that would make you that tired. But here's the thing. If your body can do it for purely physical reasons, then it has a system. And the mind-body system can just co-opt that system. It can take over any part of the body and any system the body has and go ahead and use it. Now, it usually can only take it so far because it needs the cooperation of the body, but it can take it very far. And so I would say mind-body work can offer real healing from this. Some people say that, actually, I got this from Dan Buglio, who's going to be on, I believe we're going to have him on this week, actually, on Thursday, but I have to look at the schedule to make sure I have that right. But he says he doesn't really love the word healing for this. Now, I think it is a form of healing, but I know what he means. If you go too far down the path of using the word healing, you think there's something wrong, there's something damaged, there's an illness. So I agree with him, especially in this kind of case. I don't think that chronic fatigue syndrome requires healing, but it does require mastering a lot of doubt. It also may relate to your power column. Those two things are the things that can really hold people back from getting better. I will say this, I've worked with people with chronic fatigue syndrome. Again, I'm hoping that I have the right CFS in mind. If I don't, get back to me. But I'm still glad we're touching on this. I've worked with people before and changed their process of fatigue. I've even seen it in myself. There are days where I get just a wave of fatigue and it feels just like you got hit by a truck. You can't get past it. What I will say is usually that is an emotional experience for me. But for most people who have gotten diagnosed with chronic fatigue syndrome, it's much more a doubt and a power question. So the question later in the question was, do I see full recovery? Yes, I do think that is not only very possible, I actually think it's inevitable if you can get to the right belief system. Now, I want to jump back to where I was. Matt, did I answer your question enough about kind of a visualization board? Let me know if I did. You can put it in the comments. Jumping back, though, to power and being able to believe it. There was a question, I'm not remembering where it was from now, but it was about how we get to think of ourselves as somebody who is powerful enough to be able to get better. And how are you supposed to believe that logic? Well, the question was about the fact that how do I tell myself a good story that will allow me to get past that problem? And how do I think about myself? And what I was saying is, hey, you have to remember when you've been through trauma and you've chosen a pathway that doesn't hurt other people, you can start to think of yourself logically as someone who has done a really good job. And that's going to allow you to get to a powerful position. The logic of that, because what I'm saying is not illogical. Some people will say, oh, no, it doesn't feel that way to me. But if I said it about someone else, would you believe it? I bet you would. And if it applies to other people, it's illogical to say it does not apply to you. So you need to start treating yourself like anyone else that you would be empathic towards. That's part of the way you can start to convince yourself from a logic perspective that you actually are a more powerful being than you thought. And when you start to apply that, that brings your doubts down, and that can allow you to move forward. We have a question from Paula. Let's bring that up. If one had a mind-body disorder and didn't address it, would it eventually go away or not? Shouldn't the body's intelligence everyone talks about let you know eventually? So much in these questions. Great question, Paula. If one had a mind-body disorder and didn't address it, would it eventually go away or not? It really depends on your belief system, Paula. Matt, I saw you say, yep, that I answered your question. I'm glad I did. Thank you for letting me know. So it really depends on your belief system, Paula. People who feel pretty confident and don't have a lot of fear, yes, the mind-body issue would eventually go away. But the vast majority of us who have mind-body symptoms tend to have more worries about these things, and it's partly because of all the stuff we've been through. So we have good reason to worry, and that is why it sometimes gets chronic and doesn't go away. So what I do say is that once you've discovered the mind-body process and you have a good set of protocols with yourself, then it actually can go away sometimes. I actually was talking about this earlier today in a meeting. I had some mind-body pain where I was getting a pain right here, and it lasted about a week. This was about 2 weeks ago. And I kept doubt at bay enough that it really wasn't any kind of major problem, but it was nagging there. And I was starting to doubt, is this going to go away? Well, once you know the mind-body process, then you can actually rely on the fact that it eventually will just go away. And that is what happened. I did not figure out what emotional thing it was exactly, although I had several leads, and that did help with the pain. I had several doubts that popped up, and I crushed those as best I could. I did a pretty good job with it. I used my power column to elevate myself there. I used all of the tools that I had to keep it under control, but it wasn't totally going away. And I had to recognize that eventually it would just go away on its own. With those tools in mind, yes, it will. Without them, it could drag on for your whole life. The good news is it doesn't take that much to break it. The second part of Paula's question, shouldn't the body's intelligence that everyone talks about let you know eventually? Well, this is also a little bit of a complicated one because the fact is the body's intelligence is trying to tell you something, but it's also trying to disguise it. So if you don't know about the mind-body connection, not just in general, but actually in a very specific, deep way, which is why I like to talk about the things I talk about, I'm getting you guys specific information that you need. knowing about the mind-body process isn't enough. You need to know how it works to get the body and mind to a place where it knows that the communication can actually be heard. Then you may need help understanding what it is communicating. When I work in the emotions column, I help people develop the themes and understand how they can explain a part of the self and what's going on. So the body's intelligence should let you know eventually. It actually is letting you know, but it's letting you know in the way that it can. And once you get better information and you feel more confident and the fear is down, then it can come through even more clearly. That's part of the work, to bring the fear down, the doubt down, and the power up so that you can actually get to a place where you can feel good about that. Guys, we're going to take another question or two, and then we'll have to wrap up for today. But if you haven't already, click subscribe, ring the bell for notifications, hit like if you like what you're hearing, and put your comments below. I've been having some great dialogue with people, and I want you to keep it coming. The other thing, and I actually forgot to mention this, and so we'll get to this next time, is that if you want to come on and talk to me live, you can. Now, I know a lot of people are shy about that, so it's okay. You also can come on just by audio. But the way to do that is to go to yes, 3 W's. One was that? I don't know. I almost said www.callcrushingdoubt.org. That's the site to go to if you'd like to come on, and I would love to talk to any of you here. So we're going to take one last question. We've got Matt Anderson. Sorry if I asked before, is there any update on when you expect to release the Crushing Doubt book? Can't wait to read. Thank you for that, Matt. I want to get it out as soon as possible. But the interesting thing is, I've got so much work to do with people that it slows it down. What I say, though, is the longer it takes, the better the book becomes. So it's about 3/4 done. And what I really need is maybe about 2 weeks I could get it cranked out, because I have it. It's all in here, but I got to get it out there. And I really can't wait until I do. Until then, one of the best resources I have of the written stuff is my PDFs. And if you contact me at dan@crushingdoubt.org, you can get the PDFs for a small fee. And people have said they're really helpful. There's actually a testimonial of a woman named Pat who got a PDF, just the basic PDF from me, and she got significantly better from the information there. So that can help you. But Matt, I'm hoping to have the book out probably in 3 to 4 months is my hope. And I will work on it as fast as possible. I really want to get it to you. Last question here. We've got Patrick and P to the @ It's tough to distinguish between TMS pain and normal pain/discomfort that would be expected due to such a physical activity like biking. Can normal expected pain and discomfort be amplified by TMS? Yes. These are great questions. It can be, but this is actually what I mean by a trigger. A trigger is a physical activity that can make you feel very convinced that there would be pain. The interesting thing is I used to get sore from playing basketball. The next day I would be sore every time. You know what's weird? Once I discovered the mind-body process and got myself back out there, I don't even stretch after the game. And I'm not saying this as a recommendation, but I don't stretch after the game because I don't hurt after the game. I really don't. I mean, that's actually not true. I do hurt after the game. I don't hurt the next day. But what I found is I can use my thinking to challenge the belief that it's going to hurt. So I want to put in a plug for something, and let's leave this question up because I got to get to the second part of your question. I want to put in a plug for the fact that you can challenge a lot of belief systems that you thought were just irrefutable. The idea that physical activity like biking could lead to pain and discomfort, that makes logical sense. And hundreds of thousands of people, millions of people have experienced that. So I'm not going to say it's not true. I'm not even going to say it's not true at all. And that gets us to the second question. Can normal expected pain or discomfort be amplified by TMS? Yes, for sure. Not only can it be amplified by TMS, again, that's the Sarno term for the mind-body process, but it's something that can be created entirely by the mind-body process. I have reduced all kinds of very strange things. When I play basketball and I go in for a layup and I'm expecting there to be some kind of contact, there are times where, especially if I miss, that I get pain in the back of my knee. And I have learned to challenge that is actually from some kind of physical action. It feels like it's because I stretched out and, was kind of making a strong exertion. And that makes potential logical sense. But as it turns out, if I challenge it, it goes away. Well, if I challenge it and it goes away, that's a mind-body process. So, Patrick, I think this is a question that we want to revisit a bunch. Whether you're on here or not, I'm going to revisit this a lot because the physical triggers they're big issues to overcome, whether it's shoveling snow on the steps or playing basketball or biking or lifting your kid up. These are things that people think are purely 100% physical. And I hope this is helpful information, but 100% of the time, they are not purely physical. There's a mind-body process going on all the time. So to answer your question, Patrick, not only can it amplify TMS, or TMS can amplify the pain, but that is totally the norm. It happens every time. Pain is exacerbated by TMS. If you break a bone, it's going to be worse if you've got a mind-body process added on top of it. Guys, I want to thank you all for coming on. I really enjoy answering these questions for you. I know how hard it is to be suffering out there, but there are answers, and I'm bringing information that I know wasn't anywhere else because I looked for it. The reason that I bring this information to you guys is that I'm giving you what I wished I had. And let's keep it up. We can get you past these belief systems. We can challenge the belief systems that turn out not to be true. It's all based on science and logic. It is all based in the fact that people have been cleared by doctors of anything serious. So this is not witch doctory. This is based on total logic that the mind alters the body all the time. And we know it does because of blushing, because of crying, because of goosebumps. There's all kinds of physical experiences that come from the mind. So thank you again for the people who participated. And thank you for the people who are listening and for the people who are going to put comments below. We'll be back here next week, same time. I look forward to seeing you.